I like your mug, Annie. That's good. Oh,
No.
Oh my gosh.
Aw.
So sweet. Well, welcome everybody to our admin meeting, Tuesday, April 18th, 2023. Annie, would you do some roll call for us?
Well,
Thank you.
online we have Andrew Chorney, Carrie Powers, Cheryl Hartman. Sorry, scroll down, Annie. Alicia Beckholtz, Jason Emery, Kyla Leonards, Melissa Fisher, Shane Stack, Violet Plummer, Martin Kingston, and MCAS. In 206, we have Commissioner Slotnick, Strohmeyer, and Vero. We have Chris Lounsbury, Ann Hughes, Vinnie Pavlish, Cheryl Ziegler. Thank you. I'm like, Cheryl. Mike Ash, Allison France, and myself, Annie Kathy.
Great. Thanks a lot.
Thank you.
All right. Do we have any public comment on items not on the agenda? All right. And, looks like we don't have a consent agenda. So we will jump right to action items. And our first one comes from our very own Shane Stack.
Morning, Commissioners. So this first item is simply an amendment to the MOA with the Montana Department of Transportation for the Mullen-Bill Grant project. Last fall, our contractor Hewitt was trying to pave the eastbound legs of the George Elmer roundabout for the winter. And they ran into a supply issue of trying to obtain plant mix with a binder, basically the PG 5828 binder was used. We needed a PG 6428. Basically what that means is that those are just degrees in Celsius in the performance of the mix. So a negative 28 versus a negative 28 to like a 64 degrees Celsius temperature range is where the binder was supposed to, I guess, perform at. Instead, they were only able to source the 5828, so it's it'll manage a little bit lower temperature, and that's about it in the summertime. So what that means is a little bit more susceptible to rutting. So this was just the first lift they got down. Instead of tearing all of that out and repaving it with the 6428, we proposed to MDT to just pave the second lift as a 6428. And if we see poor performance in the next 7 years, any different than the westbound George Elmer, because westbound they were able to pave with the 6428, then the county and city can come in and replace the binder. It's really just a short segment of the roadway. It's pretty low risk. So hopefully that all makes sense.
How long is the segment?
Gosh, I'll bet you probably 50 yards or 25 yards on either end. I mean, it's just a short piece on either end one.
Okay.
This does sound like low risk.
Yeah.
All right, well, let's do the second lift of the 6428.
Nice.
Good job. Seconds.
I'm just imagining how incredibly hot 64 degrees Celsius is. If 40 degrees is like over 100. It's crazy.
It's hot out there.
Yeah.
You've given us a lot to chew on.
Yeah. So we have a motion, we have a second. Do we have any public comment on this? All right, all in favor?
Aye.
Hi. Thank you. Thanks, Shane.
Geeking out with me.
Yeah, exactly. That's what we should call this segment of our nerding out on road construction with Shane. Cheryl, you're here in person. Nice to see you. Thanks for coming over.
I'm here in person. Hi, Commission. So I'm here to request the board approve a one-year extension of the contract between WellPath and the Missoula County Detention Facility. WellPath, as you know, provides our medical and mental health services to inmates incarcerated at the facility. We have exhausted our original contract. This is one of the optional one-year extension contracts. With that, they have asked for an increase in FTEs that they believe is necessary to effectively execute the contract. They do not believe that they would like to continue that contract without those additionals due to the risk that they believe they would assume. And that increase comes with a price tag of $2.244 million. And
An increase of two.
no, the increase is $544,000 off of last year. That would bring the total to 2.24.
That 540 number, that's the same as when we met a few weeks ago and talked about
Yes,
this.
it is the same as when we met and spoke about it. I did go back and speak with their leadership, and they are firm in the belief that the 2 years that they've been in this facility has sort of taught them some lessons about what they truly needed in staffing
Mhm.
versus what they brought in that original contract. And they don't feel like they can effectively continue without some of those increases.
And you
or
have
without
some
those increases.
ideas for shaving some.
Yeah,
money
so the goal at this point is to work on sort of reducing some of those outside costs that are pass-through costs through this contract. And some of those WellPath is participating in trying to bring some of those down. And those are going to include things like pharmacy and
Right.
off-of
Yep.
emergency medical. With some platforms that they're bringing into the facility that will conceivably, it hasn't gone live yet, conceivably reduce our requirement to take inmates off-site for emergency services. They'll be doing some telehealth that are at no additional cost to us that will allow inmates to meet with an emergency room doc within the confines of the facility, would be included in this contract price. And then we wouldn't be paying St. Pat's or Community for taking those individuals out.
So you know, it's not in the contract, there's still money savings, it's just the outside. of-
Sure, it's just those pass-through costs that are, with hope, I mean, this contract goes up, but those outside costs go down, hopefully bringing us to a little bit of a balance that means this won't realize a complete $544,000 increase. Like we could-
But if we extend for 1 year, I mean, we don't,
That's all we're asking for.
but then, and then reevaluate whether this is the right outfit or.
Correct. So, my intent, and I was clear with WellPath that we at this point do not believe that we'll execute any of the optional years that remain on that contract, that we will intend to go to RFP and go early. So in the conversations we've had, potentially putting out for RFP in as early as October or November, which would allow us to really get a sense of what other companies may bring. And looking around, I just had a conversation with Yellowstone Undersheriff this morning. I mean, their contract's well over 2.4. And that's with an outfit that they're extremely unhappy with. They're really struggling there. And so I want us to really have a good sense of what these are costing for vendors and be able to bring that. And to do that, we need to do it really early to see in what other directions can we go.
Yeah.
But right now we're out of time.
So, I see we have no option. We have to do this. So I just want to focus my comments, not on
Sure.
this, that
Of course.
this, we'll do this and move forward. When you, in addition to RFPing early to really get a sense of what the lay of the land is out there for other vendors, could you guys also take a hard look at what other counties are doing who do this in-house
Sure.
as yet another way, just to make sure we
Absolutely.
let no stone unturned
Absolutely.
in
And
our
that's
effort
the
to save
direction.
money and do a good job.
That's
And
the
when you
direction
say
that Missoula
in-house-
went previously. We did previously have our own contract
Mhm.
and, there were some problems with that.
Sure.
But there's problems with vendors as well. And
Yeah.
so, just trying to find that balance. The one thing to be, to just kind of consider when you do it in-house, and this is probably better for Erica to speak to than me, is that you're assuming both
Right.
sides of that risk as
Right.
well. And so you don't have anybody to share risk with when there is a bad outcome, when there is something that goes awry. These guys have to participate in those processes when we have bad outcomes,
Yeah.
when we have deaths, et cetera, if they're medically related. So that's one consideration that, you may be able to bring that number down, but
The
what
risk is greater.
What is the risk? Yeah. And the county's going to be absorbing 100% of that as opposed to having someone to share that with. But we've gone that route before. The concern for us is, and the concern for me has always been, how do we staff it? So, if someone,
It's probably well past concern too. I mean,
Yeah,
where are they
well,
gonna find?
so, these folks have something unique that we haven't experienced in vendors before, and that they have a team of individuals, because they're a nationwide company, they have a team of individuals that can come work other sites. So when they have a shift shortage, they have somebody that can't work a shift or whatever, and they can't fill it with somebody local, they fly people in. They bring them in, they
And
run
just
them.
put them up in a hotel.
Yeah, or get them housing when they need a long-term.
Good luck in Missoula.
They did, they rented houses. They
Uh-huh.
rented houses when they brought people in and, on short-term Airbnbs or otherwise, and brought people in. And so they have a capacity to fill shifts that we may not have locally. And that's always my concern. So what do I do if the nurse calls in at 8 p.m. and I can't get diabetics insulin? What do I do with that?
So
Well,
maybe
okay,
So we'd have
so-
to build a really similar team.
I,
guess is what I'm saying.
let me get in here a second.
Sure.
I totally hear you. Maybe what we could do is kind of develop a matrix. So it's money is one of the things we consider.
Mm-hmm. Sure.
Risk is another thing.
Yeah.
Staffing, there's probably
Yes.
5 other things I wouldn't know because this isn't my field of expertise. But
Right.
so that at some point next year, we can do a really good evaluation and not just say, oh, this is the cheapest, so we're going for it. Or similarly, we didn't get anything but this one vendor from an RFP, so we might as well go with them. So we
Yeah.
really make a good
No,
decision.
100%. I absolutely want to bring every option to the table and I will put every effort into doing that. I truly will. It's just I'm just sort of like
All right.
Well,
I guess.
and I guess what I would say is
throwing initial thoughts.
If
more than
they're-
anything, not final thoughts.
if- based on prior experience and what you're describing, if there are potential obstacles to us doing this in-house, what would it take to remove those obstacles?
Sure.
And if,
Yep.
if
Absolutely.
in the process of evaluating all these options, I mean, if we need to bring on a contractor to help us, I guess, explore
Yeah.
all the options, then maybe, maybe we need to some extent,
You said-
outsource the review of all of it.
Or
You said
potentially there
one-
could be some sort of hybrid model where maybe an organization would be willing to help us with backup staffing while we're running our own.
Maybe.
I mean, there's agencies within the community that provide agency nurses, Monida and otherwise that, those agency nurses are essentially just like similar to a temp employment
Mhm.
organization where they're sort of waiting for assignments. Those can be short-term, long-term, et cetera. Agency nurses are historically very expensive. So they're making upwards of $100 an hour at times. And so, it's a factor to consider, but there are certainly options for that if we could work with an agency
So the word you said everyone to latch onto was early.
early.
So
And I've advised WellPath of that, like they know
Yeah.
we will not be executing, just automatically
That's good.
executing additional.
But
years.
and do you feel like you have the resources you need to get a good RFP out and also look at in-house programs and then evaluate all these things? Or is Dave saying, do we need a consultant to figure out what are the 5 or 10 things we need to evaluate each potential option on so we make the right choice?
I don't know that I'm prepared to answer that today. I mean, I would suspect that I would never turn down expert help in terms of the medical field,
Yeah.
but in terms of being a firm, I mean, I would probably say yes, we would certainly welcome some other eyes. I would like that to be someone with some experience in
Yeah.
correctional medicine.
For sure, that's what we're doing.
Mhm.
It wouldn't make sense if it was anything else.
It's just such a weird.
I don't think WGM would.
Yeah.
The WGM is not the right consultant.
It's just a weird beast, I
course.
mean, correctional healthcare versus community healthcare versus hospitals. I mean,
And
they're different
we're not the
animals.
only one. There's plenty, there should be a good bank of knowledge out
Sure.
there.
Sure. As far as I know, in terms of larger agencies that are running their own, Gallatin's the only one that's running their own currently. And they're significantly smaller than us. But we've had some conversations with their PA because their PAs reached out to us to see how our operations
Why
were
is
going.
Gallatin smaller?
They're more well-behaved.
I don't know. They are smaller and their ADP is always lower and
What's that mean?
their average daily population. So it's just the way they.
Is there a correspond, does wealth correspond to incarceration? Is it they're just wealthier than we are and
Oh,
poorer people end up in jail more often? So
I think that's
why.
a pretty common
Yeah.
theme.
That may be it.
Folks that can't afford to bond remain
Yeah,
in jail.
not a lot of jail folks coming from Big Sky.
Probably not. Yellowstone, no, they've always, for as many years as I can remember, been a bit smaller. And some of that was guided by now DOC Director Goodkin at the time when he was the sheriff of Gallatin. And then he didn't, ironically, play well so much with the Department of Corrections at the time. And so he
Said,
refused
no,
to-
we're not taking them.
Yeah, he refused to work with a lot of Department of Corrections inmates. And so I think that probably changed the landscape in his community a little bit, that stuck. Although they are taking them now.
They do have masks?
They don't have masks. They have DOC inmates, so conditional release or parole
Oh,
violators.
Okay.
They take some of those now, where previously Goodkin was very resistant to that. We'd be begging him for beds because he had them and he'd because
Hmm.
he didn't like what the DOC paid.
I understand.
Chris,
Sort of ironic switch, isn't it?
Let me question. So this is committing ourselves to $500,000 more per year in next fiscal year's budget. How do we
Yeah, so
do this without, outside of the budget cycle?
yeah, so it'll come out of the one-time only bucket when you consider fiscal year 2024. So the available funding that you have for one-time projects next year will be reduced by
$500,000.
Considerably.
$1 million. So, I mean, it will reduce it significantly.
But okay, and then the other part of that equation, the reduction.
Yep, hopefully we can drive some of that down, so you're not looking at a full
Do you
$500,000.
have an estimate or
I wish I
guesstimate?
could, but given that it's not, so I mean, when I brought last year or last week when we spoke, was the last week or the week before, my weeks are running together. In terms of our offsite visits to the hospital, we had 92 in the year 2022, right? Just for emergency room visits. Each of those come with a cost anywhere between, $1,500 and $4,000, significant money, depending on if they're ultimately admitted or otherwise, but that can be some significant change right there. Where they've deployed WellPath now in other sites, they've seen an average of 40% reduction in those offsite visits. So, I mean, it's not chump change. It's not $500,000, but it's not chump change. And then we are able to divert a little bit of grant funds, which is going to take off of this already, to the tune of just a little over $100,000, which is going to bring this number to, down to 444, kind of right off in the HART grant funds that we had set aside for a transport officer, a position we can't fill. And HART has told us that they will not continue next year, but they are going to allow us to divert that back to one of the therapists that fall under this contract. So that'll help some as well, and we have that funding through next year. So I mean, we're taking chunks off of it where we can, and we'll do a good job of trying to document where we're reducing those those outside costs or those pass-through costs to try to bring this down. But I don't have a great prediction for what that's going to look like.
Okay, well, I move that we approve the 1-year extension.
Do we have any public comment on this? All in favor?
Well, Andrew.
Does Andrew have some comment?
Vander.
I was just gonna say, I think can bring in some consulting help on this project is worthwhile. This is a big ticket item. I was just looking, just asking Dr. Google what was available. There are literally pages of correctional healthcare consultants that will come in and evaluate your programs. So maybe there's someone out there for us.
Yeah, so I can really like the early and ask for whatever resources we need so we make a really good decision, not oh shit, we ran out of time, we got to do this, all we have is
where
the
we're at
one
this year,
vendor.
right? And we recognize.
Totally get that. And man, I'm not chastising you at all. We're going to do the right thing. We're moving forward. But for next year, let's have a really robust process and not be afraid of doing something different if that might be the best thing.
Understood.
Thanks for your patience.
Thank you.
Yeah,
And
thank.
all your expertise.
I know it's not what we had all hoped to see at the table, but it is. It's where we're at. But I
Just
appreciate
happens
you guys.
once.
Thank you.
And thanks, Andrew.
Thank you, Andrew. Thanks for coming over too.
Pleasure.
We get to see probably Captain Hash next week on a telephone.
All right.
Oh, okay.
The good news is that one's a no cost.
Okay.
Hey, that's our favorite.
Thank you.
Hyla, you're up next.
Hi, Commissioners. I just have a few board appointments. The first one is for the Elections Advisory Committee. We had Denver Henderson, a regular member, resign, leaving the seat vacant. The let's try again. The current alternate, Susan Mace, has expressed interest in moving to the regular member seat. So this is just appointing Susan, the current alternate, to fill the remainder of the regular member seat through January 31st, 2024 to the Elections Advisory Committee. And if this is approved, then we will notice and put out appointments and advertise for the alternate seat.
That's a real loss.
That is a huge
super
loss.
Thoughtful guy, very smart and knows this stuff well. That's sad.
And move that we appoint Susan Mace.
Second.
Any public comment on this? All right, all in favor?
Aye.
Aye. Thank you, Kyla.
Okay,
You have another one.
and I do. I have a second one. The second one is for the Fair Event Committee. We've had one vacant alternate seat for quite some time. We received 2 applications, Keith Kopriva and Haley Joe Bergsom. Keith, after has actually rescinded his application. So Haley Joe is the only one available for the appointment. And the request would be to appoint her to fill the remainder of the alternate seat through September 30th, 2024 to the Fair Event Committee.
I'd move to appoint Haley Jo Bergstrom.
I'll second that.
Any public comment on this? All right, all in favor?
Aye.
Thanks.
Thank you.
Doesn't look like we have any correspondence. Any discussion items? All right.
Legislative update, none?
They're still there. They're still there.
I believe we are done.
Happening.
Thanks, everybody.
Bye.
Oh, great.